Hi, my name is Andy. I'm a student at Valencia College. Today I'm going to be performing a physical assessment video. For the purposes of the video, we will not be assessing the femoral pulse. We will be auscultating and palpating over clothing, and we will not be listening to the apical pulse for a full minute. All critical elements have been completed prior to the start of filming, such as washing my hands, checking the chart, gathering my supplies, and cleaning my equipment. So here we go. Hello. Hi, my name's Andy. Student nurse today. How are we feeling?
I'm doing better.
Okay, well hopefully we'll make you great. Before we begin though, is it okay if I check some information on your wristband?
Sure.
Alright, I can take a look at that. Could you verify your name and date of birth for me?
Lakota Morel, 8/28/90.
Okay, fantastic. And Mr. Morrell, do you have any allergies to food, contact, environmental, or medication factors?
No.
Okay, fantastic. Matches everything we have here. And before we go any further, with 0 being no pain and 10 being the worst you've ever felt, how would you rate your pain right now?
I'd say about a 2.
A 2? And where would you say it is?
Back of my head.
Okay. And how would you describe it?
Like a throbbing.
Throbbing?
Yeah.
How long has it been going on?
About an hour.
Okay. And anything make it feel better or worse?
Just laying down usually.
Okay, laying down. And do you want anything for it right now?
No.
Okay, great. Well, in that case, I am here to perform a physical assessment, so that will be a head-to-toe assessment requiring me to touch you, feel you, and listen to some of your sounds. Is it okay if I continue?
Okay.
Okay, great. Now, could I see your glasses real quick? I'll go ahead and set these aside for now. All right. And do you know where you are?
Valencia Memorial Hospital.
Okay, and what year is it?
It is 2019.
2019. That's always a tricky one. And who's currently the president? Could I look this way? All right. And could I have you look the other way? Have you experienced any abnormal drainage from your ears recently?
No.
What about your nose?
No.
Okay, fantastic. These are good. I'm going to shine this light. Please keep your eyes right on my nose, okay? I'm going to shine this into your eyes. Okay. Good reaction. Wonderful. All right. Hold this up. Please keep your eye on the pen light as it approaches your field of vision. All right, good accommodation. If I could have you lean your head back and open your mouth for me. All right, and you mentioned no drainage. Have you had any recent trauma or fractures or surgeries to your nose or your mouth? Okay, great. Could you stick out your tongue for me? All right, and smile for me. All right, wonderful. All right, I'm going to check your pulses real quick. Very good, strong pulse. Could I have you shrug for me? Awesome. All right, checking that. Let me see your elbows real quick. Skin looks good. Check your pulses here. Pulses there. If I could have your hand out for me like so. Yeah, very good. All right, fingers good. If I could have you squeeze my fingers. Very good. Push against my hands and pull. All right, good strength in your upper extremities. I'm going to check your legs now. All right, very good. Knees look good. Pulses feel very good. Pulses feel good. All right, check the capillary flow. And if I could have you push against my hands. All right, push down, push against, and pull. Wonderful. Strength down there is 5 out of 5 as well. Strong guy. You work out. All right. I'm going to go ahead and listen to some lung sounds for you right now. If I could have you in a Superman pose for me, and then every time I set the stethoscope on you, if you could take a breath for me, okay? All right. Keep it up. All right, if I could have you turn this way for me so I can get to your back. Wonderful. All right, same rules. Fantastic. Your lung sounds great. Nice and clear across the board. So if I could have you go ahead and lie down for me. Get you laying down now. Next part, I'm going to assess your heart and your abdomen. So, real quick. In the meantime, could I ask, when was the last time you had a bowel movement?
About 3 hours ago.
Okay. The last time you urinated?
That's 3 hours ago.
Okay. And have you been experiencing any abnormal gas?
Nothing more than usual.
Okay. That's good to hear. All right. So I'm going to start by listening to your lung sounds. I'm going to listen to your aortic and pulmonic valves, as well as listening to your apical pulse for a bit, okay? So I'm going to start with your aortic. Very good. And then these will be your pulmonic valves. So the blood coming back in. Alright. This is your apical pulse. Normally we'd listen for a full minute. Today we're not going to do that. Okay. Heart sounds are good. Nice and strong. Alright, and I'm checking out your abdomen right now. Don't see any signs of distension or lesions. That's a good sign. Alright, I'm going to give it a quick listen, make sure we've got some bowel activity. Very good. Bowel sounds is all 4 quadrants, so that's good. We've got plenty of movement there. I'm going to palpate lightly. Let me know if you experience any tenderness or pain, okay? Alright, belly's nice and soft, no signs of distension or bloating, so that's good. Alright, Mr. Merle, that concludes the assessment. Back to my earlier question, with 0 being no pain and 10 being the worst pain you've ever felt. How are you feeling right now?
It feels better now I'm laying down.
Okay, so how would you rate that?
0.
0? Okay, fantastic. In that case then, I'm going to leave you here. Your call light is right there on the side of the bed. Let me know if you have any questions. If not, I'll be back in about an hour to check up on you, okay?
Sounds good.
Alright, fantastic. I'm going to leave your glasses on the night table. You can grab them whenever you'd like. And I'll see you in a bit. Alright, take care. At this point, I would wash my hands and document accordingly.